Good morning, everyone. Are we waiting for everyone to come in, Hannah?
Yes, we've just got some people dialing in now.
Brilliant. We'll wait for everyone to join. I can see the participants' numbers going at the bottom. Welcome, everyone. Very excited to have you with us today. Speakers, as we start, it would be lovely to have your images up if you can do that for us just as we begin to welcome everyone. Thank you. Excellent. It's always tricky with those blank screens. You slip in and out of them, so you have to be quite close to the front. Thanks, that's the stuff, Hannah. Really, and you as well, Hannah. We'd love to see your face. Your main support system behind the system. Thank you. And Hannah, tell me when you think we've got. I know participants will join during the morning, but just let me know when you think the majority have come in, and we'll get going. I can. Or we could actually do a photo.
Yeah, we could do it.
Can you do a screenshot? While we're waiting for everybody, mental health team who are on the screen now, how about a nice big smile and we'll get a screenshot? Excellent. Meletta, we can't see you very well. Your light behind is quite bright, so I'm not sure whether you can darken that before you speak. It's lovely to see everybody's faces. Beautiful, thank you. How are we going, Hannah?
Yeah, I think maybe might be the right time to start now as people are joining this morning.
Okay. We're in a relative hurry, but we're not in a hurry. So I'd just like to welcome everyone to today's webinar. Oceanic Mental Health Advisory Committee are very, very excited to have this mental health webinar today for across the Pacific. And I will start by inviting Charlene to do the welcome to country. But Charlene has an OAM. Well done, Charlene. Excellent.
Thank you.
You're a Wiradjuri woman and you're a mother with 3 adult children and quite a few grandchildren by the looks. You're the board member for your local Aboriginal Land Council. Charlene also has a deep passion for supporting people with complex mental health issues and is a member of the Suicide Prevention Lived Experience Network. Charlene delivers cultural coaching to organisations and individuals. And you have a very long list of committees that you work on, Charlene, so we thank you for that. It sounds like you're a very, very busy woman, including member of the New South Wales Ministry Carers Strategy Aboriginal Working Group. I love that you're an Oxfam straight talker. I'd love to know more what that's about. And chairperson of the Disability Justin Project for Aboriginal Communities of Practice. And I just welcome you to start us off today. Thank you so much.
Thanks very much, Michelle. I'm very happy to be here to welcome everybody to this webinar. I would like to acknowledge all Indigenous people across the Pacific, pay my respects to their elders past, present and emerging. The theme of Mental Health Week is making it a global priority for everybody. So I think that there's a lot of learning that can happen from Indigenous communities across the Pacific about the way that we take care of our people who have mental health issues, about the cultural and spirituality elements of that. And I think that then there's an opportunity to have really good conversations about that amongst each other. And I'd look forward and I'd hope that that would be facilitated as part of this objective moving forward. I'm certainly keen to connect with others and share stories and share wisdom and knowledge. I also acknowledge people with lived experience of mental health, pay my respects to them. I hope that you really enjoy your webinar. Unfortunately, I can't stay on here. I've been contracted to work with someone else on Wednesdays, but I did find it important that I greeted you all. And I look forward to seeing the outcomes from this. Enjoy your day, everybody.
Thank you so much, Charlene.
Thank you.
That was really lovely. Thank you so much. I'd now like to hand over to Julie Miller. Julie's going to just give us a brief overview. Julie is a credentialed mental health nurse, which I'm very excited about being a nurse myself. She's an educator and a consultant in mental health who's based in Sydney. Julie is the board director of the regional and regional vice president of the Oceanic for the World Federation for Mental Health and the chair of the Oceanic Mental Health Advisory Committee, and really has been the driving force behind this webinar and some of the regional work that we're trying to get off the ground. So thank you so much, Julie, for that strong work that you're doing. Over to you.
Great. Thank you, Michelle, and thank you to Charlene. Before I begin, I would like to acknowledge the Indigenous peoples across the Pacific and pay my respect to elders past and present and to any Indigenous people here today. I'd also like to acknowledge the lived and living experience of people with mental health issues and emotional distress, their families and carers, and recognise the contributions people have made to mental health reform globally. So I'm just going to take a few minutes to talk to you about the World Federation for Mental Health and the Oceania Mental Health Advisory Committee and its proposed work. So the World Federation for Mental Health, it's a global volunteer membership organisation that was founded in 1948. It's the mission of the Federation really is to promote mental health awareness and to undertake advocacy. So they're not a direct service provider, but also to get people
thinking. Could you just put your slides up fully? We can still see the sidebar just at the bottom. Beautiful.
Hannah?
That's it. Push that button.
Oh.
Oh, good. Keep going. It's not coming up.
Okay. So, yeah, and just to discuss best practice in recovery-focused interventions worldwide. So, World Mental Health Day is one of the activities of the Federation, and it was first observed in 1992. So the day, officially commemorated every year on the 10th of October, just aims to raise awareness in the global community about the critical mental health agendas. So getting people to come together, to talk with a unifying voice and collaborate with each other, really to take action and to create lasting change. Each year, the theme is chosen by a global vote of Federation members, stakeholders, and supporters. So the theme for 2022 was Make Mental Health and Wellbeing for All a Global Priority. How are we going with my slides? Oh. Hannah, down the bottom on this little tiny, right on the bottom row, the little tiny screen, that one, yeah. That should do it. So I'll keep going. The Federation has a number of sections. For example, the Women's Mental Health section has a long and rich history of influencing global discussions and highlighting, for example, the socioeconomic, environmental, political, and human rights challenges which women encounter and the impact that it has on mental health. And we have a number of webinars. As a regional vice president for Oceania, that's an appointment by the board, I have a responsibility to really seek to build on the Federation's international outreach and strategies to sort of look at enhancing membership, but to build relationships with members of each country to promote mental health awareness in the region. Hannah, you could probably stop sharing if you like. Thanks. So the World Federation, in collaboration with the Mental Health Australia, established this year the Oceania Mental Health Advisory Committee. So members have come together to look at sharing information and resources, responding to diversity, and trying to support sustainable capacity building and professional development in the region. So the committee has members with lived experience, Aboriginal community consultants, health professionals, and representatives from universities, mental health commissions, and peak bodies. Of course, the recently released World Health Organization World Mental Health Report and the regional framework for the future of mental health in the Western Pacific will guide our thinking and be the foundation for a future action plan. We understand that this is a long-term goal. This is not going to be a 5-minute change in how we can all work together. So what's next is still unknown, as many more discussions need to be held with community members of each nation to ensure community leadership, lived experience development, and self-determination at all stages. So I look forward to today and listening to what everyone has to say. We have some understanding about the mental health challenges and opportunities in the Oceania region and the Pacific, but we all still need to learn. So thank you everyone for being here today.
Thank you so much, Julie. That was excellent and really giving us a grounding on where we're hoping to go. So as Julie says, the WHO has got a new framework for mental health in the region, and we're certainly hoping to use that as a guiding post. But while online, if you have any questions from any of our speakers, please put them in the chat. We really would like some ideas from you about some of the actions we can do in the future. Do you want more webinars? What would you like us to do strategically in the region? Are there any ideas you have? But also, we've got some really excellent speakers today. So do not be afraid to put some questions in as we go along. We'll try and get those questions asked at the end of the session. So it is with great pleasure now that I introduce our keynote speaker. Professor Helen Herman is Professor of Psychiatry at the Centre for Youth and Mental Health at the University of Melbourne. She's also Director of a World Health Organization Collaborating Centre for Mental Health. She's a former president of the World Psychiatric Association. Her research and development interests are in promoting mental health, community mental health care, and women's mental health. She has an enormous amount of publications and also was chair of the recent Lancet Commission, which was around time for united action on depression. So please look up that paper. Over to you, Helen. Thank you so much. You're on mute.
Thank you very much, Michelle. I'm delighted to be here, and thank you and Julie and the committee for the invitation and all the arrangements and creating this event. I'm also endorse warmly the acknowledgements to Indigenous peoples around the Pacific, including those people on the land that I'm speaking from. Excuse me, a frog in the throat. So I'm speaking from Melbourne, from Wurundjeri country, and acknowledge the privilege of being here. And it's wonderful to greet colleagues from around the Pacific, from across the region. So I'm delighted to talk to you a little bit about the Collaborating Centre, the WHO Collaborating Centre, as invited to do. And I'll tell you briefly about its history and then some of its current objectives and activities, and put that in the context also of the regional framework that has just been mentioned by Julie and Michelle. So I thought in the moments, in the time available, we could talk a bit about what it's possible to do, and that may give some idea about what other possibilities there are as well for people across this vast region. My own journey with the World Health Organization began too many years ago to count, but it was around about the end of the 1980s. And we've been a collaborating centre or part of one for since 1995. And at the moment, I'm director of the centre along with Professor Chi Yung, also here in Melbourne. And we work together along with colleagues in the Western Pacific Regional Office and in WHO Geneva. So I thought to begin by talking about the terms of reference that we have. And of course, everybody has their particular interest, but the terms of reference that we have does, I think, represent the broad interests and broad range of activities in which WHO is engaged and eager to support. There's so many needs in so many different areas. But the first terms of reference, and one that I'm particularly engaged with, is to support WHO globally and regionally, wherever that opportunity may come up, to contribute to developing policy, practice and research and workforce development to promote mental health in young women and men in adversity, including maternal mental health and school mental health. I can go into that a little further as we go on. And the second terms of reference led by Chi Yung is to facilitate the training of people in mental health and substance use response and community mental health development programs across the broader region. So coming back to the first reference point, so supporting the promotion of mental health, we are looking at the support for promoting mental health in schools by looking at a whole school approach and looking at the improvement of the school atmosphere or school climate and reducing bullying and promoting collaborative and cooperative working and learning, support for teachers, support for the role of parents, teachers, pupils, school leaders in promoting better relationships and social and emotional learning in schools. And the WHO has also been interested in the development of local resources for the school and teachers and students and parents. And with Origin, with whom I work in Melbourne, in Australia, there's been some materials developed that have been piloted in Tonga and Cambodia, and they're aligned with the WHO school promoting health, school health concept. And I somehow missed out reference there to the second part of the work of terms of reference 1, which is particularly looking at promoting mental health in the perinatal period through supporting women and families in terms of the status of women in societies to begin with, support for workforce and recognition of violence in the home and how to prevent that and to support women in particular who've been subject to that, including during the perinatal period. So moving on to facilitating training and community mental health development programs, the first part of this second terms of reference is to support the development of the mental health workforce in the Pacific. And as you'll see below, there's been a particular remit from Western Pacific region to train and support, provide resources to local organisations to support mental health staff and professionals in Fiji and Kiribati and Tonga, and to increase the capacity of the range of health staff to assess and manage mental health conditions, including substance abuse disorders. And the people working together with this include Chi and his group at the University of Melbourne, working with the Western Pacific Region Office and including the South Pacific Office in Suva. Ministries of health in the countries, which are, of course, are the natural partners of the World Health Organization, and Fiji National University and the Royal Australian New Zealand College of Psychiatrists has been engaged in this as well. And the second part of this is to support the development of community mental health programs. And this is really taking advantage of Professor Chi Young's relationship with the development of a mental health program with the organisation of APEC countries, the Asian Pacific Economic Community. And those countries in the Western Pacific region, China, Malaysia, Japan, Philippines, Singapore, Korea, Papua New Guinea and Vietnam. So there's a huge populations involved there. But to work together with WHO and ministries and governments and non-government sectors in the countries to strengthen service delivery in non-mental health settings, so including in general health as part of the World Health Organization's interest in universal health care and addictive behaviours, and to work with civil societies in that and other groups of particularly people living with mental health, with lived experience of mental ill health and their families, and to review the policy and the practice related to integrating mental health services in the primary healthcare system as a primary objective. So I thought I'd move to, with that background, to move on to the developing regional framework for mental health for the Western Pacific Regional Office. And this is about next week, will be taken to the regional committee meeting in WHO for discussion and potential endorsement by that committee for use across the region. And I believe a number of people on the call here will have been involved with developing this framework. And I take the liberty of presenting it because I've had been engaged as an advisor in developing it as well. And I believe it is disseminating information about it will be welcome by Martin van den Dijk and the team in Manila. So I present it, though I'm certainly not in charge of it. But this also brings me to thinking about, as I stop sharing this and move on to another presentation, also brings me about to be thinking about what is the place of the World Health Organization in our region. Sorry, wanting to move to another one. Okay, says I'm screen sharing, but I have to get rid of that one first.
We can see the future of mental health up there, Helen.
You can, good. Yes, I couldn't. I think right. I still had the other one blocking my view. So here we go.
Beautiful, we can see it now.
Right. So the World Health Organization, of course, works alongside and particularly works at the request of governments in the region. And the Western Pacific region goes way beyond Oceania, as you know, although most of the member states are the island states. They're the most numerous countries in the region, are the island states in the Pacific. And then further north, we most northerly have China, Korea, Japan, and come south through some of the Asian countries to Papua New Guinea, Australia, New Zealand, and the Pacific. So it's about 1/3 of the world's population represented across the region. And this this framework was developed with different groups of countries having separate discussions and then coming together to have a joint consultations. But one of the early consultations was in the Pacific, where a number of Pacific countries were brought together with the engagement of Jen Hall in Suva in the WHO's Western Pacific office, and the PIMNet, the Pacific Island Mental Health Network, was convened. And this is a group of mental health points of government points in the Pacific countries. It's received support across the years from the New Zealand government and been supported by WHO really over the last 20 years. And it's been a decisive point. Looking at the Pacific view of mental health has been very influential in the development of this framework. The technical lead in Manila, as many of you will know, is Martin van den Dijk, who's been a very clear and strong leader of this work, together with consultants from Japan, Dr. Ben Oki, and Rachel Burgess from London, and his colleagues in the Pacific, in the WHO office in Manila. And right throughout, as throughout the terms of reference that I've described to you, the emphasis has been on working with people with lived experience, as well as working with communities, including Indigenous communities, and really seeking to have local leadership along with each government, and to promote to the governments also the idea that the framework for mental health needs to engage those with that lived experience and the local communities. So the objectives were really to promote those, the journey was to look at the co-creating this vision over the last numbers of years, and then have a framework that would set the scene for at least 5 years, and those member state dialogues. A number of World Health Organization and other reports were brought to the fore. So the previous mental health agenda that also a number of people were involved in would be influential. This end of the regional agenda for the Mental Health Action Plan 2013 to 2020. And all of this in the light of the WHO's Mental Health Action Plan established in 2013. Here's the plan up till 2020, and this was renewed last year to extend to 2030 with the same objectives, which include objectives relating to governance, also relating to comprehensive integrated mental health services, integrated with general health and social services. And the third objective is the prevention of mental ill health and the promotion of mental health in all countries. And the fourth one related to promotion of research and data and monitoring of service and mental health status. And then the third guiding point was the Western Pacific Region's report for the future, which has a number of thematic priorities that are on the right there. And the new framework is developed in the light of those. So looking at health and security, looking at integration with non-communicable diseases, taking note of the high and emergency needs to examine climate change, the environment and their relationship with health, and reaching the unreached. This has been particularly important. And in that in that frame atmosphere, there's been strong engagement with considering the role of mental health within health and within the achievement of the UN Sustainable Development Goals. I won't say too much about those goals now, but I know that many people will be aware of the United Nations setting these goals to succeed the previous Millennium Development Goals. And despite all the obstacles in its path, is still aiming to make good progress in each of these, including goal number 3 in health, which includes mental health for the first time, and gender equality, as well as climate action and the other goals. I think the message being that without good mental health, these can't be achieved, as well as vice versa. The regions characterised by social vulnerabilities and pressures with the implications on mental health. I won't go through them, but on the left hand there, there are notes about some of them, and on the right hand side, emphasising that as well as the needs for promoting mental health, there's an outstanding need to prevent mental ill health and treat and promote treatment and recovery. And the 200 million people affected in the region, predominantly younger people, the burden of disease it rises steeply in the 20s and 30s for young people across the region, in high, middle and low income countries across the region. And of course, the burden, including loneliness and mental and disabilities related to mental ill health, persist across the ages for a great number of people as well. So looking at the previous agenda showed quite a lot of unfinished business, ranging from development of mental health laws, as well as their implementation, and lack of community resources and information systems, and the underemphasis on mental health and prevention over a continuing almost complete focus on mental illness was seen as a question to be examined with governments and communities, and an emphasis on scaling up of services over quality improvement. So the importance of a rights-based approach, human rights being fundamental to good mental health, and the narrow focus and scope of the consideration of mental health altogether. So that what the aim was to refocus the agenda to include well-being and reaching those people, the great number living, particularly the people most in need of at highest risk of mental ill health, those living in poverty, those subject to discrimination, including gender and racial and other forms of discrimination, and including the Indigenous peoples. And transforming mental health care so that it is integrated and part of community supports and the broader health considerations, and ensuring that mental health is part of where we live and work in the communities, in families, in schools, workplaces, or working environments, and in the way that older people live, connected with families and with each other, and with meaningful activities. So I'm sorry I've brought up the wrong, I did make a choice of things to show you, so I'll just go through with that without focusing on some things. But this is really emphasising that role of those of us with an interest in mental health, in emphasising to policymakers and local communities that we understand, we'd like to work with local communities to understand what's important to them and provide any advice they're seeking on how to support healthy parenting, adequate care for mothers and children and families, positive parenting, schooling, making sure that the educational system and the mental health expertise can work together to promote social and emotional learning, and supported peer groups, reduction of exposure to violence in the communities, and reduction of harmful use of substance, and meaningful work and relationships. And the unity of health and mental health, and the importance of overcoming stigma, mainly by showing how effective we can be at assisting people living with mental ill health and their families. And then transforming communities, ensuring that effective treatments are available, even though they're not widely accessible in most countries now. Looking at the proven ways to respond to the treatment gap in scarce resource, but also in places such as I'm speaking to you, where we don't necessarily make best use of the resources we have. So task sharing, so-called, with local health workers and communities, and supporting that work with always a reference point through to expertise in mental health, and the collaborative care approach, where the people living with mental ill health and their families are in the centre, linked with local health workers, primary health care, social systems, and mental health expertise, all part of universal health care. And alternatives to coercion. Still a big problem in many parts of the region that prisons are often the default place for safe refuge. And looking at, there are ways to provide effective humane care that even in scarce resource settings. The importance of working together, public health and mental health, that they've been alienated and across time, but coming together more, particularly in the period of the pandemic. So in making sure that mental health is everyone's business, and integrating mental health in all that that governments do, and our role in achieving that. And finally, engaging communities, so looking at these social determinants. Sorry, I'll come to an end now.
Thank you.
Thank you. So that was aiming to give you an overview of what's happening in the region. And I know that Julie and others, yourself, Michelle, are well versed in this, and look forward to further discussion.
Brilliant. Thank you so much, Helen. And I mean, I took some really, really important messages around the gaps in community and emergency, that we've got to have a stronger focus on wellness, and really big scaling up needs to be done in the region, both in health workforce and services, and that, you know, the stigma issue continues. So really problematic there. One of the questions here, and I'm just going to throw it out to you, Helen, to think on as we go along, is how is personal spiritual being supported in mental health, suicide prevention generally, noting that the WHO definition of recovery 2021 includes spiritual and integration into an indigenous social. So just keep that one in mind as we go along. There's quite a few questions around us sharing the presentations, and I know this is being recorded, and I know there's quite a lot of resources, so I'm sure we'll be able to share some of the presentations and the resources from today towards the end. So keep those questions coming in the question and answer, because we want a lively debate at the end, so thank you for that. I'd now like to hand over to Imita Norris. I hope I said your name correctly, Imita. Say that again.
Emelita.
Emelita, thank you so much.
Leonoris, yeah.
Yeah, Leonoris. And you're an artist, a musician, and an entrepreneur, so it's fantastic to have you with us. A mental health and youth advocate and a mother of four, so another incredibly busy woman. You grew up in South Auckland, New Zealand, and have been living in Brisbane for more than 25 years, but you have a real passion to work with independent Polynesian females. And you're working on the CALD, the Cultural and Linguistic Diversity, with culturally and linguistic diverse backgrounds, whom you have a natural affinity, obviously. You've worked closely with young people, utilising self-empowerment or self-determination as an underlying process to ultimately equip them with the right tools needed to heal. So we're really looking forward to your presentation this morning. Thank you so much for being with us.
Thank you for that. So yeah, my name is Emelita Leonoris. Before I start, I just want to acknowledge the Indigenous peoples across the Pacific and the peoples here, that the land that I'm speaking from, the Meanjin land, Brisbane, and also pay my respects to their cultures and elders, both past and present and emerging. Also want to acknowledge the lived experience people as well. So my story is I'm a mother of four. During the pandemic 2020, my daughter attempted to take her life and ended up in a psychiatric ward. And during that time, I went looking for services that help I guess multicultural families navigate the mental health system, because, you know, my daughter was detained under the Mental Health Act. We didn't know what that was. It was the first time I had heard of it. So from that experience, I somehow came across Mental Health Australia, and now I'm part of their Embrace project, which is provides a national focus on mental health and suicide prevention for people from culturally and linguistic diverse backgrounds. So I set up I guess, a company called Manumia, which I thought would help families like myself, multicultural families, to navigate the mental health system, because if I struggled and I couldn't speak English, I was wondering what other families that, you know, whose second language, whose first language was not English, how they would navigate the mental health system. So basically that was set up to help multicultural families navigate the mental health system, but it's actually morphed into a cultural holistic sort of collective, because in my findings of trying to find services that would help with recovery with my daughter, you know, I came across multicultural, you know, massage therapists. Like in our culture, it's being Samoan, you know, we have people that do the fufu or massage. I came across, you know, multicultural art therapists, animal therapists, and it brought me right back to things like weaving therapy and cultural dance groups, dancing, which is so important to any forms of healing, because I guess I found that treatment and recovery looks different to everyone. Sorry, I don't have any slides or anything. I'm not that great and I'm not tech savvy. But so through Manumia, I didn't know how to, you know, talk about mental health, because you know, it's a real stigma in our community. So I decided to create a group of a space for women, and because I was in business, I'd attend mainstream women's events, and I noticed I didn't come across a lot of women or called women that would attend these mainstream women's events. Maybe I'd see the odd Asian woman or an Indian woman. And so I wondered why, called women wouldn't, attend these mainstream events. So I decided to trial it. And I got together some friends that were looking at getting into business and those who were in business, and set up Women of Culture in Business. So we, often have monthly meetups. And then I'd ask them, I said, well, why don't you guys attend these mainstream women's business events? And, the answer was like, oh, I don't have the confidence to talk in front of people. I don't like meeting new people. So by creating these meetups, I find that multicultural women, were very entrepreneurial, very talented. And one of the common things is we kind of just get each other. We don't have to explain anything. If there's a language barrier, we understand, and we add humor to that and that kind of thing. But hearing these women's stories and getting into business, a lot of these stories touched on elements of mental health, and the feedback that I've been getting is it's a space that they can come, and like I said, that we can just connect and we get each other. It's also a space for women who are not in business, because some of the stories of the women that are in business may inspire someone to start something of their own. And so that's where that's come from. And so the Manumia has now morphed into, I'm actually creating a database or a directory of cultural holistic services that are out there, that a lot of, I guess, some of us who are not so tech savvy, but I've got a husband who's quite tech savvy, so he's building this directory and database for me. So some of the services we have used, like the music therapist, and I have used myself, a psychotherapist who does family constellations and life coaches. So I'm collecting all these, I guess, contacts, and then I'm hoping to put it somewhere, somewhere online so it's accessible to all families, not only sort of multicultural families, because I know when my daughter was in the ward, I said to the doctors, how can this space be conducive to healing? Because she was 19 at the time, and she had just, come out of school. She had much lived experience. So it was a real struggle. And let alone cultural healing, conducive to cultural healing. So when she ended up there, what I'd like to see in the mental health system is even a gendered space where, males are separated from females.
I wish I could be there to give you a hug, my dear. But a powerful woman.
I didn't want to. I just want to build this database and directory as a community resource to help families and on their loved ones, to access services that they didn't know that were out there. My work in the community, with women of culture and business, and also I work closely with our Polynesian community on the north side of Brisbane. We run the Pacifica Playgroup, so I've been involved with that for about 17 years, and so we'll be having these talks with our mothers, because I guess the women's group is so important, because as they say, when you educate the mother or the woman, she'll educate the family. And that's where I'd like to focus a lot of my work on with our women in our community. It's important to empower them, and yes, they will empower their families. I'm sorry. Yes, I've just sort of lost my train of thought, but thank you for this opportunity.
There's a question here which is really relevant, and it just says, could you please send the links to your organisations that you've been working with, navigating mental health, etc. And it like you're doing an absolutely amazing job, and that's come from one of the participants. And I think that's what I think you're trying to grapple with, is how to share that information. It sounds like you've been collecting an enormous amount of information, so I think that's something we can talk more within this group, but just add anything more if you want to at the end to close.
Yeah, I'm just I just found that, I guess, there's no one size it sort of fits all model. I think, treatment and recovery looks different for everyone. And, in the hospital system, they call it the treatment team. I'd like to change it to the wellness team, rather than calling it the treatment team, to, focus on something more positive. So, we were all talking about wellness. So, that's one of the things. And sort of being trauma informed, things as simple as we had in the hospital would be visiting our daughter every day, and the receptionist, I remember one day she'd see us, and I remember one day she would look at my daughter's name, and she would say, "Oh, that's too hard to pronounce." And they don't realise that our names are our identity and who we are. And if you're not even going to want to even try to pronounce, our names, it's just dismissing who we are. Anyway, hang on, I'll just grab something here. So the stigmas in our community, I'm glad that I've met a group of, multicultural women that are also passionate about mental health, their mental health and their family's mental health. But I'd like to, I guess, see more of our community leaders embrace this topic and talk freely about it. So that's, I guess, my sort of ending to my talk.
No, thank you. That's powerful. And there's lots and lots of amazing comments saying you're an amazing, I love your authenticity, tears and clenched tissues needed. Thank you so much for sharing your personal experience and doing so much to help others. Wellness team perfect. So lots and lots of comments and questions in there. So have a look at those.
Thank you. Yeah, I will
come back at the end with some comments around some of those things. Thank you so much.
Thank you.
Really appreciate that.
Thanks.
It's always really hard to move on from such a powerful personal experience. I'd like to go to Jimmy Obeid now. We've got a video from him. He's actually traveling to the Auckland conference as we speak, and I think he's in the air. So many of you know Dr. Jimmy Obeid. He's the only psychiatrist in Vanuatu. He graduated with a diploma in mental health from Fiji. He's got a master's in psychiatry from Melbourne, Australia, and is the president of the Oceanic Society for Mental Health Professionals. He's been working in mental health for many, many years. And what I love about Jimmy is he says, I enjoy spending time in tropical beaches and the sea. He's obviously looking after his own wellness as well. So Hannah, can I pass over to you for the video? Thank you.
Good morning, everyone. My name is Dr. Jimmy Obeid, and I...
Hannah, we need it a little louder if possible.
Clinician in Vanuatu, the main referral hospital in Vanuatu. And I'm happy to share with you some of the work that we do.
Still can't hear that, Hannah. I'm not sure if anybody else can hear it.
It's actually quite quiet, so I will just see if there's a way to further increase the volume on here. Okay, so this seems to be as loud as it will go.
Good morning, everyone. My name is Dr. Jimmy Obeid, and I am a mental health clinician in Vanuatu, the main referral hospital in Vanuatu. And I'm happy to share with you some of the work that we do for mental health here in Vanuatu, and some of the challenges that we face, some ways that we are working in addressing those issues and in providing better mental health services, and also, some resources that would be of benefit to advance the work of mental health here in Vanuatu. One of the challenges is the limited number of formally trained mental health clinicians. We currently have about 3 nurses who are formally trained to provide mental health service, and also 1 doctor to cater for a population of about 300,000 people, and to meet the demands of mental health in the country. So that in itself is a challenge. We have also within the private sector people who, GPs who provide some mental health service as well, but they're mostly located in urban areas. The remoteness of our islands and our communities and villages is one of the biggest challenge, I think, when it comes to mental health service delivery in Vanuatu. So we have about 82 islands and a population of about 300,000 people, and so to be able to travel and go to these remote places is very challenging. It's either too costly or too risky. So you travel by boat or by plane or on foot. So it's very, very challenging to get to some of these remote villages. Stigma within the health profession is another huge challenge that affects mental health service delivery. An example of that would be, you get called in to see a patient, and you walk up, and people just pass it on without really treating these people as any other patient. Also in terms of allocation of resources can be very challenging because of that within our Ministry of Health. On a larger scale, policies within our Ministry of Health, there's some policies that do not really support the service delivery, especially in remote areas. An example is the medications that are made available at, for example, health center level or dispensary level. Sometimes they're not readily available, so it really limits the access to treatment in the remote communities. Some of the strategies that we use to address some of these challenges is what we call strategic collaboration. That is basically understanding your context, seeing where you can get most support and tap into other people's resources at organizations or institutions or government sectors, giving them the ownership of some of the mental health service delivery, and meeting them halfway and negotiating and just maximizing an efficient use of the resources that we have. So there's not so much innovative, but just being more wise in how we use resources. So an example of this is the forensic services that we are trying to get up and running. So we find ourselves working closely with the police, with the Law Society, and also with the correctional people, so the Ministry of Justice. And in the absence of a Mental Health Act that is current, it's these relationships that has been built that makes police want to work with us in terms of going out into the community to give treatment, or to seek out a patient that is in the community that might be causing some disturbance in the community. For us here in Vanuatu, resources that would be most beneficial to us is the access to training. We have people who are interested in coming into mental health, to join the mental health team to be able to provide mental health services. What we lack is access to training and the support to get formal training to be able to provide quality mental health service to our people. So that is briefly what mental health service delivery looks like here in Vanuatu, and some of the challenges that we face, resources that would greatly benefit us to be able to offer better mental health service delivery, and also some ways that we're trying to provide mental health service and advance mental health services. So thank you for listening.
Thank you so much, everybody. I know that volume was very low on that, and we'll hopefully share that video alongside the webinar video. And I think Jimmy's messages will be repeated with our other speakers around the real need, strength and service delivery, the lack of access to training. And I think that's across the Pacific. I know for mental health nurses, we only have 4 programs and they don't run very often. He did talk about, though, how we maybe need to include strategic collaborations, how we need to work together more with other partners in country. And I loved his words. Anybody who knows Jimmy, he said we've got to be wiser with our resources and really be able to collaborate. But I think his biggest message was the need to access more training. Sorry for those of you who couldn't hear, but I think it was important to honour Jimmy's video, so thank you for that. I'm now handing over to Dr. Stefani Callaway, and I hope I've said that correct, and please introduce yourself properly, correctly afterwards. You've obtained your MBBS from Fiji and a diploma in mental health from FNU and a Master's of Psychiatry from the University of Melbourne. You've worked in the area of mental health for over 10 years and you're currently a lecturer in psychiatry at FNU, so thank you for that, because we know how important that is in the region. Interesting to see that you worked with the Fiji military forces in Egypt and Iran, and that you've completed your medical internship at Labasa Hospital that we know well. So over to you, and thank you so much. Can't hear you. Yeah.
Thank you very much, Dr. Yep. So again, let me introduce myself. I'm Dr. Sefa. Sefa Nayangaloewai. I'm Itoke and I'm from Fiji. So I'll be presenting on Fiji following Vanuatu. Dr. Jimmy. Dr. Jimmy is a close colleague and we've worked together before as well. So Mbula Vinaka, everyone. I'll be answering the questions that Dr. Jimmy had answered as well. So I'll touch on the challenges that here in Fiji we face as far as mental health services is concerned. Let me just give you a brief background about Fiji. We are a population of about 100,000. We have over 300 islands. About 100 of the islands are inhabited. We have 3 divisions that has the health system existing on. So we have the central, the northern, and the western division. We have a public health system as well as the curative part of medicine, which consists of the tertiary hospitals that exist within the 3 divisions. Our mental health service, we have 1 tertiary hospital that is in the mainland, that's St. Giles Hospital, and we have decentralized the mental health service to the divisional hospitals, the 3 divisional hospitals, back in 2010. So we have a stress management ward that runs at the central divisional hospital, that is the CWM, 1 at the Lautoka Hospital, which is in the west, and 1 stress ward at Lambasa, which is in the north. It's a separate island from the main island. So challenges that we have, particularly after COVID, we have an overburdened mental health service, and I'm sure that is also a finding from around the world. We had our own challenges before COVID, but since after COVID, things have become even more pronounced. So we are now seeing many consumers coming to our tertiary as well as our primary care. A lot of mental health issues. The most common one that we are seeing now is substance-related problems, particularly cannabis, kava, and the newer one, which is methamphetamines. We're seeing that users are young, within the school and primary school age group, secondary school and primary school age group, and early adulthood, male, and from lower social economic background. Just to give you an idea of over the last couple of, last 3 months, we've been seeing about 2,000 to 3,000 patients in outpatient department at St. Giles Hospital, and that's quite a lot compared to last year's and the years before that. Another challenge is we lack the specialized service, such as the child and adolescent services. We don't have a comprehensive psychosocial rehabilitation program as well as a drug rehabilitation program. And we have a lot of revolving door patients because we lack those elements in the mental health service. We also have, like Vanuatu, we don't have enough manpower. We have a brain drain within the mental health service. A lot of our doctors come in and they leave. They leave for overseas, and some they move on to private practice. These are trained mental health professionals who've done the diploma program at the FNU. We also have problems with medications, and we lack psychological services, the psychotherapies. We have very old medications that are still around, haven't been revised. We still have long-acting antipsychotics that have been phased out in Australia and New Zealand. We still have them around here. So we have a lot of patients with issues with medications. At our tertiary hospital, we have only one counselor, psychologist. So can you imagine the 1,000 plus in the last 3 months with only one counselor? So we can figure out how loaded that is. Lack of resources. Like Dr. Jimmy had mentioned, we try to be wise and use whatever that we have to cater for the many number of patients that do come through our service. So we have 3 divisional stress wards. These stress wards are within the main tertiary hospitals. And one of our stress wards is now lacking a doctor. So now everyone is being referred to the tertiary psychiatric hospital here in Suva. Another challenge is we tend to work in isolation, and that's been happening over the years in the past. For example, within the health system, we know that we lack the child and adolescent service, and we do have a pediatrics department. We run clinics there once in a month, but I feel we can utilize that even more. But we know that lack of manpower leads to problems in running the clinic. So to begin with, we have lack of manpower. We have the facility, we have the pediatric department, we have the ONG department where we can potentially run perinatal services, but we don't have the manpower. So that's another area of need. So we have problems within the health system, and then we have problems within the outside of the health system. So for example, issues about homelessness, patients who don't have support, adequate support, so they end up on the street. So we don't have that unity, working together with the social department, the education sector, as well as the local government to try and coordinate the service. So that's another issue. Innovative strategies that our country is taking. So we've come up with this concept, connecting back to the vanua, connecting back to the land. A lot of our people move from the rural to the urban area for better opportunities. And most have been here in the urban centers, urban areas for years, and they've lost that connection with their villages where they originally come from. And we know that that is such an important concept because that's their identity, and they have their land and they have their family, they have the culture. And so we're trying to get people reconnect back to their land, and hopefully in a way that captures psychosocial rehabilitation, in our own context. Because we know the Western concept about psychosocial rehab, but maybe it'll work within our community. So which means getting them back to their villages, back to their islands, and sort of have rehabilitation from that perspective. So that's a concept that we're exploring, and I think it'll work. We've tried a couple of patients going back to their villages, and it worked well because that acts as a safety net for them as well. So that's a telehealth services. So that's One thing about Fiji is everyone has access to gadgets, and even in the islands, in the rural communities, and internet is quite affordable. So we're trying to use that to our advantage, providing, some of the services that could be, that is provided in the hospitals, that we can do it through online. So I think that would be something that it would be beneficial for us. We have online courses as well. The FNU have developed the Masters of Psychiatry course. Hopefully next year it'll begin. So we've got all the paperwork done. It's just waiting for the right people to run the program. Aside from funds and workforce, what other resources would be of benefit to Fiji? What we're thinking is telepsychiatric services. More online activity would be beneficial, particularly in the area of creating awareness and doing it in the local language and adapting it to the Pacific context. Marrying it to the culture of the land. I think that's the way to go. If there's any kind of support for that, it will really help us getting the message across. And also translating screening tools for mental health problems into the vernacular would be very helpful. And it will really draw people to identify issues much earlier. And so we can, intervene early than later, as we often see the patients do come to the hospital when they're really, really, really sick. And we have a culture of sharing in Fiji, and thinking of, using the online platform as a way to share information and also adapting it in the local language and culture. Thank you. That's about it for me. Naka.
Thank you so much. That was really powerful. And there's one question from Bill around, to think about towards the end around how we can just decrease some of the services to stop that revolving door that you talked about. I think some of the things and also I know our other colleagues will come on, and it's interesting that you're saying Fiji has relatively reasonably cheap internet services. I know across the Pacific that's not necessarily the case. It can be really expensive in other Pacific islands. Great to hear about the online FNU courses, and I know that there's a new FNU nursing emergency course and some other master's courses that are being a lot more innovative around the region to enable some sharing. But yeah, I think your online discussion might be something we can bring up later, because I think there's different contexts across the Pacific, but really, really useful. Thank you so much. That was really helpful. Excellent. Hopefully we can discuss a bit more at the end. Now I will hand over to Olivia Foa. We have a video from her. So Hannah, if you'd like to prepare that. She's a New Zealand-born musician and director and dancer. She has Tokelauan and Tuvaluan and British heritage, and she's known for her internationally acclaimed Polynesian band Te Va'a, which had the vocals heavily in the Disney's Moana soundtrack. So I'm really looking forward to hearing this. Thank you. Over to you, Hannah.
Akahetai watu aloha, tenga liuna taimi, he oli lahi te hia hia. Kiki lunga ve he matangi, mea ke vehe lalo langi tatou. Taku wo pele, haula ke tahiva. Taku wo pele. Manatua na heo Gongalo atu Te haika kata ma te hiohia E he mahaina poli Oku mahau hau tangi loto aloha i loto. Taku wo pele, tue tahi la te tahiwa. Taku wo pele, pele, tue tahiwa taua. Talohi e taui taua I te lumanaki Manui e tau haiwa Malanga ki ko Hiki ki longa Hai pena aloha Nā koko e lava I tōku loto Taku o pele Haola ke tahiwa Taku o pele pele mawai ai taua Toi tahi Taku o pele Toi tahi la te tahiwa Taku o pele pele Toi tahiwa taua
Oh, that was beautiful. Thank you so much. And I think we need to acknowledge Olivia's contribution to music in the Pacific, and she won the Best Female Artist in the Pacific Music Awards in 2020. Some of her YouTube videos have had over 9 million hits. So I think when we're talking about wise partners and we're talking about wellness, to connect with people like this beautiful Pacific woman are really helpful. Thank you for that. Very bizarrely, I have to introduce myself. I just have a very few slides to share with you around a basic psychosocial skills program that was developed through our WHO Collaborating Centre here at the University of Technology for Sydney with a Pacific working group. We were asked to be a WHO Collaborating Centre by 15 countries in the South Pacific back in 2006, and we've worked in this space for over 18 years with nurses and midwives across the region. This basic psychosocial skills resource was produced globally. And as we've talked about over and over again, it was really important to adapt that for the local context. We had a Pacific-wide working group, and there's a few people online today who are on that working group. The basic psychosocial skills resources were developed for anybody in the community. So even though it was developed around COVID-19, they were really useful skills. And a minute later, they may be useful for some of your groups too. The basic psychosocial skills program is an online program with online resources and a facilitator's guide. And it talks around what are basic psychosocial skills, what are the interactions every day, and practical support and emotional support, why the basic psychosocial skills development training was developed during the COVID-19 pandemic. The program also outlines why these skills are so important. There are 5 modules to the program, and I'm obviously not going through the program. I'm just giving you very much a highlight. Module 1 is about an individual's well-being. The program is online, so you either have a presentation and training resources, or you have an online program, which is 3 hours. And if the individual fulfills the free online program, they get a certificate at the end. Module 2 is around everyday interactions. Module 3 is around practical support. So giving ideas to the individuals on how they can get practical support and how they can manage their own problems. Number 4 module is emotional support. So really it's basic psychosocial skills. So around listening and communication, encouraging people to help themselves, helping those who are in serious distress. And finally, module 4 is around how we can ensure the rest of the community is connected. And a lot of the discussions and case studies are around stigma of both mental health and the COVID-19 pandemic and a whole variety of other areas. The free online program, we will share these resources out. These are all the links and how to link into the free online program, which is 3 hours long. And I will stop sharing and hand over to Hannah, who will play just a short video. All of the online program were produced with Pacific colleagues. Thanks, Hannah.
In preparing for or responding to COVID-19 in your community, first responders will regularly interact with community members. This video contains...
Can't hear this very well, Hannah. Is that as loud as it goes through the advance?
Yeah, let me just try again.
Okay, if not, we can share the resources. That's not a problem. In fact, we're running a little bit tight for time, so don't worry. We'll share the resources with everyone afterwards. What I just really wanted to highlight from the short video is we have 4 very short videos which outline each module, and each of the videos and all the products have been produced by Pacific colleagues from 5 or 6 countries across the Pacific. All the case studies, all the stories have been developed with our Pacific colleagues. This program is so user-friendly and so down to earth that actually it's been utilized globally, even though it was actually produced for the Pacific. So thank you for that. I will, as we're running a little bit tight on time, we'll make sure all these resources are shared with everyone. Okay, I will now hand over to Kathy. So Kathy, thank you so much for joining us. Kathy's from Kiribati. She works in mental health department for many years, completed her postgraduate diploma in FNU and was appointed the head of the mental health for the Ministry of Health in Kiribati. So over to you, Kathy. Thank you so much for joining us. You're on mute, Kathy. Excellent.
Okay, thank you very much for the introduction and for the opportunity to be able to share some of the challenges in Kiribati in our department. I want to thank my colleagues, Dr. Jim and Dr. Sapanaya. I got to know them in Fiji, and the challenges that they face in their country, I believe my country is double or triple the challenges, but I would like to discuss just a few challenges that we're facing. Ever since the borders were open after the lockdown, we've had a problem with the shortage of nurses. There is a lot of intake to Australia of our nurses going for healthcare. This is a good opportunity for them, but there are no more nurses, very short staff, and so in our department there should be 1 to 7 patients, and our nurses are taken to the emergency department or the medical department to cover up those areas. So the innovative strategies our country is trying to taking is increasing nursing students to study nurse, increasing the intake. And for the new graduates, they're now all setting them in our department. But the new graduates that come to our department don't have any skills in mental health. Most of the nurses that left are the ones that have lots of experience. So to train the nurses to give good mental health care is a problem, and we need training to our new graduates in the ward. So if for capacity building. And so with the shortage of nurses, we use most of the support workers to help us to give that nursing care. So we need training too for our support workers so that we can manage with the patients that we have. We have 35 male patients currently admitted and 18 female patients. And we have only one nurse, male nurse to the male patients and one nurse to the female patient and a sister in charge. So the service delivery is quite difficult when we have a lot of aggressive patients. So that's one of the challenges we face. The other challenge is the transport of patients. We've had problems with the police. They keep, when we ask help, they always say it's not their job, it's the ministry's job. And we're thankful for our Mental Health Act, Kiribati Mental Health Act. We had our final consultation just on the 12th of October before I came here, and we sat down with the Ministry of Justice, the AG's office, the High Court, the police, the prison services, and the ministries that we needed to sit down with, and they have approved of our Mental Health Act, and the ministry is ready to pass this act probably next year. And so with this Mental Health Act, it will really help with the transporting of patients with police assistance. Another challenge is we do not have a psychologist. Since the lockdown, we had volunteers from overseas, from New Zealand, and they helped us a lot in our department. But since then, we have had no psychologists. So we've had increase of anxiety cases, depression cases, and I just have to manage to try to give them a bit of counseling, but we're not trained for it, and we really need psychologists. And the government realized that there were no psychologists, so there are students they're sending now students to Australia to do psychology, and the ministry is preparing a post for psychologists so that it can be there, and we can have, if we have volunteers from overseas coming to help us out in the country, the post is available. Another challenge that we have is the low stock of medication. So we have a lot of problems with medication supply. So we've had emergency supplies from Australia and from other Pacific countries like Nauru, and we hope that this problem will be able to be, will be solved, and hopefully maybe next year they will be able to have all our medications, especially the long acting. So I know my time's up, so those are the main issues I would like to share with everyone.
Thank you so much. That was really powerful, and certainly having worked in Kiribati for many years with my nursing colleagues, interesting to hear you're having a workforce issue there too. We know that Fiji has lost a lot of nurses to the labour mobility scheme, and a lot of working in New Zealand and Australia. We've also heard that with Solomon Islands. So through SPCNMOA, we're about to launch a work value study, and certainly I think we're getting the message that to include some specialist areas around mental health in that work value study across the region will be really useful. So thank you very much for that update. Now I'd like to go to George Philomena Mala. I'm not sure how you say your name, surname, George, in Samoa. I'm sure you could correct me. You've got an MBS from Oceania University of Medicine in Samoa, postgraduate diploma in mental health, Auckland, New Zealand, and you've been a consultant to WHO in the WHO Manila office, I know, for a few years, and are currently the head of Department for Mental Health in the Ministry of Health in Samoa. Over to you. Please introduce yourself correctly. Thank you.
Thank you for that, Dr. Michelle. Can you hear me properly?
Yes, I can hear you very well.
Okay. Talo falava, and hello to everyone. I think when they put the bio there, I thought we only put the serious stuff in the bio. So I missed out the other stuff in the bio that and the other stuff in the bio is that I enjoy farming. I love planting. I love gardening, and I enjoy sports very well. So I played a big part.
We need more of that sharing for wellness. Thank you.
Okay. Well, yes. Before I became full-time in this, I used to do a lot of social activities as well. So now it's just down to farming and looking after the unit. So yeah, I enjoy my work, but I enjoy my time with my family more, and I enjoy the time with friends and other colleagues most. And the likes of that is these trainings and workshops as well. Opportunity to share and opportunity to listen from others too. So without further ado, I know we are strapped for time, so I'll go straight into the requirements of our presentation today. So the first one is the challenges. So I've divided the challenges down. Again, the obvious ones that we have, of course, is the resources. See, so to give a little bit of context, we have about 14 nurses and myself as a psychiatrist or the doctor for our unit. Well, this is for a population of 200,000, over 200,000 people, divided into 4 main islands. 2 are the mostly populated, and we have to cover a whole range of services. Now, some of these services is child and adolescents, geriatric, the youth, the maternal, and the worst ones, or the most difficult ones that we have at the moment is alcohol and substance use, and substance use disorders, and also, of course, the forensic requirements of our work, which is forensic psychiatry. So yes, so that's the little bit of context. So we have to see a little bit of everything. The problem is that we built this new unit. We did so many awareness programs, and in our unit as well, we divided our service into the community, the step-down service, and we also have a seclusion unit, which is an inpatient service. And because the unit became very small, we had to do an MOU with an NGO to use their facility as an offsite ward. So in our offsite ward, we hold about 15 to 20, and we try and make it not an institution. So it's just like a halfway home, a respite. It's like a transitional phase in which patients that are not sick enough to be admitted, but not well enough to be at home. So we are using that NGO facility. In our seclusion unit, is mostly full now of police cases and mainly forensic cases. And then we have our outpatient setting within the unit, and then our step down. So so I mentioned one of those challenges is the forensic. So the problem is now, because of the awareness and because of people's knowledge towards mental health, a lot of the prisoners and a lot of people that are coming to courts are now pleading insanity. Are now pleading, and even the lawyers are trying to use, a mental illness or mental disorders as sort of a way to lighten the punishment, or as sort of a way to get away from the punishment completely. So in simple terms, our report and our witness can determine whether hypothetically speaking, whether a murderer is locked up for life or able to walk free. So that's the weight and the difficulty of our work is that it cannot be done. We told them that it cannot be done just by one aspect, which is our opinion. It needs to be done with several other opinions, and also they need a specialist to do this. But unfortunately, the courts and also the Ministry of Health realizes that hiring a forensic psychiatrist is equivalent to hiring 5 full-time doctors to work in Samoa. But hiring a forensic psychiatrist to come and just do 1 or 2 court reports can cost the equal amount of 5 salaries for a doctor. So the cost for that is unfortunately something that the Ministry of Health and Justice needs to work on. So that is also a challenge because the weight is now on us. We make it clear that we're not forensic psychiatrists. We make it clear as well that our report is neutral. Our report is non-biased, and then we report mainly on our observations with the patient during in the ward, and also when with treatment, with or without treatment. The other challenge Dr. Jimmy has mentioned is that we also like to echo it from our side is the training for all the different areas. Now we know that it's very difficult to get some in-house training. So any sponsorship or any scholarships or any support as well to have some of these trainings available overseas will be greatly appreciated. Second one, what are the integration? How are our innovative ideas? So the innovative ideas that we've got now and the things that we're doing now that really is helping our work is that we are integrating with the NGOs and other government organizations. In other words, we're piggyback on the already existing programs. So when they go out to do, a police talk on, how safety on the roads, like say, for example, for primary schools, we piggyback on that and say that, can we join you? And then have maybe only 10 minutes to present about mental well-being. So it became quite popular per se with these departments as they can all relate to mental health. So mental health started to become, a general talk within all the ministries, and now everyone wants sort of a mental health aspect in it. So the awareness programs that we've got in these NGOs and government organizations has really improved our work. And that is improving it by people now coming up and presenting with the problem, getting people to talk about mental health, getting the government ministries and even the public servants to actually acknowledge when they become stressed that it is a health problem. So they now have a mental health aspect in most of their programs and most of their social activities. Again, the problem is that when you raise the awareness and you still have limited resources, you get with a really high demand. So it becomes very imbalanced as well. But, we're still hanging in there and we're still hoping for the best that perhaps miracles can happen. And maybe the more at some level when the awareness gets full blown, maybe there will be a little support on the resources and helps in other areas too. Sports and other social activities. So now, we've got a touch tournament that is famous here in Samoa now. It's called, people like to play rugby, but we don't want people to tackle each other and cause more brain injury or any contact sports, especially when we're trying to promote mental health. So we're using touch rugby, and it's it's still a contact sport, but you don't get to injure the other person. You only get to touch them a little bit, or the tag. So, and we call it the Touch Me Mentally. And it's a tournament that's been going now for almost 10 years. And because we raise it with the other sports also wanted to take part in that too. So again, it's that awareness. What other innovative ideas? Because they couldn't get some more resources, mainly in the areas of psychiatrists and doctors to work for us, we also made sure that we have the most updated medications. So you could say that all medications that are available in New Zealand and Australia are the same medications we have here in Samoa. So it's very costly, but I'm very fortunate to have one of my part-time consultant psychiatrists from Australia, Dr. Ian Parkin, to really fight for us in a political level and getting all the medications that we have. So we have clozapine, we have olanzapine, we have paliperidone. So all the latest antipsychotics, antidepressants, all the other mood stabilizers we have that available in our country now. And there's always a talk every month. So I'm also part of the emergency medicine list. So I have to attend these meetings, because if I don't attend, they usually try and cut funds and say, look, we probably don't need this much antipsychotics. So we have to make sure that some of our staff is available for that. Innovative idea. So there's one course now for counseling, and it's by APTC, and that's also from Australia. And it's a basic counseling course, but again, it's getting people to, it's sort of identifying and giving people the awareness that there are courses out there that can be options as other basic courses like nursing or engineering or carpentry. There's a course that you can actually take to actually help talk to people. So the other thing as well is the disability with some government support. So because mental health and mental disorders are now classified together with disability, we've actually tapped into the disability funds. So now everyone which is diagnosed with mental illness or mental disorders gets a disability fund. And this is like a benefit. So they get like 100 tala every month. So again, you can imagine now a lot of people are coming in and say, hey, I've got depression. Can you write me a letter? And hey, I've got anxiety. Can you write me a letter and do this? So unfortunately, it's not that simple. We have to go through a lot of screening tests as well. So, and the final one is that the challenges and how can we make it easier, apart from the resources and the money. The big question is that, you know, the main thing that's coming to my head now is we've been trying for years to get the human resource and people to be attracted to work for mental health, people to actually, you know, but unfortunately, you know, when they come in for those attachments, when they come in for those covers, there is that a seriousness and let's say a different sort of weight in this sort of health care that is very different from the other units. So the biggest question that I also always ask my mind is that how can we make mental health look sexy? How can we, simple as that, how can we make it look attractive? You know, it's the interns, when they go through medical school, you know, they say, oh yeah, I feel like I want to be in psychiatry. But when they come and actually work there and see and compare it to other units, it's like a unit, it's like a unit with a different sort of aspect. You need a lot of patience. You need not just, you know, a strong mental health to work in a unit. You also need to be physically strong. So it's a combination of everything, you know. And I always tell people and tell my staff as well that in order to work at the mental health unit, you have to be physically, mentally, and spiritually strong to work in the unit. There's no other units in a hospital that, you know, we get to give forced treatments. And sometimes when the police come over to sort of bring patients over, most of the policemen are not trained into properly restraining the patient. So we end up doing it. And if we're bringing in a very acute and violent patient, you know, with only one security and 2 nurses on duty, I have no choice but, you know, to roll up my sleeves and actually jump in and be one of the restrainers. And so you have to do a little bit of everything. And I hope I'm within my 5 minutes. So thank you so much for the time again. But that is my very short answers in a nutshell of the requirement, the 3 required questions that was given out earlier.
Thank you so much, George. Really, really helpful. And I think that some of that sharing of innovation has been going on all morning, but I think you've really summed up some of those innovative approaches. So thank you. As we're so short of time, I'm going to move swiftly on to Professor Giorgio Ravilo, from Professor and Chair of Social Work and Social Studies at Sydney School of Education. His research writing areas of interest include mental health and wellbeing. And you have many, many publications. So welcome. And we look forward to hearing from you. As you know, we're a little tight on time. So thank you so much. Brilliant. Over to you.
Naka Nissan Bulavanaka, and g'day, my name is Chochi Ravulo, yes, and I'm Professor and Chair of Social Work and Policy Studies at the University of Sydney, and I'm delighted to be here. I also, as part of our in-country protocols, acknowledge that the traditional owners of the lands in which I'm located acknowledge that those lands are unceded and still considered stolen, and to continue to reiterate an ongoing commitment to work collaboratively with Indigenous knowledges and perspectives. And it's with that in mind that this research project called Mental Health Talanoa that I was leading over the years was born. How do we continue to create a Talanoa with our own Pacifica communities in the diaspora, but also regionally, that is grounded in Pacific epistemologies and ontologies, in Pacific ways of knowing and doing, being and becoming. So this research project was funded by the New South Wales Ministry of Health, alongside primary health networks across the region who are federally funded, to create this particular approach to look at 3 key areas. How do we promote an understanding of the symptomology associated with Pacific communities and their experience of mental distress in the context of mental health and wellbeing? How do we promote help-seeking behaviour, and also understand the morbidities associated with mental illness? But more so also, how do we also create workforce development and hold health systems across the region accountable for ensuring that they are also decolonizing their approaches to ensure that Pacific ways of knowing and doing, being and becoming is meaningfully included in the mental health space. So this research project was grounded within the specific locality here in Western Sydney, where a high proportion of Pacific people live. But we also then work collaboratively with an array of different health professionals across the islands, including George Tuatama, who I've met previously in my work in Samoa, and other health professionals. So shout out to George. Hi. Good to see you again. Dr. Obed in Vanuatu, and other people across Erisita Topo, Dr. Erisita Topo in Tonga. And this project, as you can see here, literally we've got a social media presence. So I'm going to quickly flick to that, because I'm going to encourage people to actually access our resources that came from this research project in and of itself. So let me quickly stop share this screen, and I'm going to quickly go across to our web-based resources that I'm going to encourage people to access. So here they are here. So literally, if you go onto Google and type in mental health Talanoa, you'll see a link here for the National Library of Australia. And this is where our report is located, on this link here. And this is where you can actually download the 100-page document that outlines our research project. But more so, I want to draw our attention to the actual infographics that came from the report itself. So if I scroll down, sorry, let me quickly scroll down, I'm conscious of time. I'm going to get to the key outputs that we actually developed apart from our YouTube videos. So if you want to know more about our project and our resources, then go to our Mental Health Talanoa YouTube channel, which is at MH
This is really interesting, Giorgio. So we've got a few more minutes, so don't rush too much. We're really enjoying this. So just
okay, cool.
all good. So don't rush too much. We're all
okay. Awesome. Thanks. So in this particular report, I'll go to the report and then I'll also show the YouTube videos. But in this particular report, I'll go quickly to our infographics. And so in our infographics, and I'll just quickly see if I press play here, can people still see that screen?
Yes, we can.
Okay, brilliant. So in the back section of this 100-page report, we've got our series of infographics. Now, I'll start with this one that looked at the symptomology associated with Pacific communities and how they may experience certain symptoms associated with certain common mental disorders. We did a quantitative statistical analysis based on some survey data that was specifically with Pacific communities, and we looked at their trends associated with certain symptoms associated with these common mental disorders like depression, anxiety, but also this notion of lack of capacity and exhaustion and the somatic symptoms as well. And so really this particular resource has been designed to encourage, again, a mental health talanoa across our Pacific communities, across the region, to also engage with health professionals, to also start to look at some of these particular areas, because a lot of the time in our experience and in both my clinical work that I continue to do, but also the research, we found that a lot of times Pacifica people may not be aware of the symptoms associated with these common mental disorders. So it was about being able to map this out and encourage also health professionals to access these particular resources, print that off, put it in their waiting rooms, put it in their actual resources to actually have those conversations. The other key thing I just quickly highlighted was that we had a series of key themes that came from the research itself, and that includes things like judgment, stigma, and barrier to accessing mental health care, the need for education, psychoeducation, and lack of appreciation for the complexity of mental health concerns. So a big part also with this notion of mental health literacies. How do we promote mental health literacies amongst Pacific Indigenous communities across the region? Some other key themes also included the cultural impacts of mental health and also cultural expectations associated with our engagement in the health space. The other key thing is that we also then developed some key research recommendations, and that really in essence talks about how do we continue to work collaboratively with health professionals, practitioners, but also our broader community, starting with our young people, our parents, our broader community gatherings. How do we continue to engage and to create scope for a mental health talanoa to occur? Now, the other very last thing I will mention is this set of Pacific Indigenous mental health lexicons, which we're really excited about. And this actually was developed in consultation with our health professionals in the islands themselves, we found that a lot of the time when we talked in language about mental illness, a lot of our terminology across our Pacific Indigenous languages have generally been quite negative. So we wanted to create a series of lexicons across the different languages. So we've got Bislama, Fijian, Samoan, and Tongan that further talks about terminology for those particular mental health phrases that was going to be more strength-based and more grounded in some of our Pacific Indigenous languages that was more pro-social and proactive, leading to help-seeking behaviours. So you can see that we worked again with a whole series of different health practitioners and professionals across the islands. Dr. George, you're acknowledged here in this one as part of our, my engagement in the broader region and how we've talked about the different areas associated with the use of our Indigenous languages in this space. Again, in Fijian, we worked alongside with local professionals and then also ensured that in Bislama with Vanuatu, we have that as well. So I'll quickly stop share then, and I'll just quickly, as my last thing, is go back to so I'll go back to that. And I know I've talked really quickly, but I just have a lot to say. Very excited about it. Just our Mental Health Talanoa YouTube channel. If you look, there's an overview of the actual research project itself. So that goes for about 5 minutes. And then you'll see that we also then have a couple of videos that talk about the actual infographics themselves. But then we also have the Pacific Indigenous Mental Health Lexicons, and we've got most of the people that may have been involved, or one person that may be involved in developing those lexicons actually talk to camera for those particular phrases. So I'd encourage you to check those out in the different languages at our launch event, and also another wellbeing that we developed actually in response to COVID. And thank you, everyone.
Thank you so much. That was really powerful, really useful, and really fast. So stunning. Some of my research is in Talanoa and Kakala too. So I think really good to have that voice across the Pacific being shared. We're very aware this is the first of the Oceanic Mental Health webinars. And I'd like to thank the steering committee of both the Oceanic Mental Health Advisory Board and the steering committee for this webinar. And I think in true Pacific style, we've really taken up the whole of our time in these discussions. I think offline, our advisory group has just had a quick chat around, we will produce some recommendations or guidelines. I think we need some more of these and more opportunities to share and talk. A lot of the questions have been answered in the question and answer, and I can see there's a few people coming up now saying thank you so much for this presentation and this webinar. We will share the presentations and resources because I think they're just hugely useful. I think we've done full circle. A lot of the issues the WHO framework has brought up around community emergency, a stronger focus on wellness and scaling up of the health workforce and services have been brought up by many. George, I especially like some of your innovative approaches, but also highlighting some of those huge challenges you're having around individuals in prisons, and I think that needs to be alerted to within the Pacific, because that might be something that may be problems in other countries. Looking at more innovative approaches around sports, and I think Jimmy also brought some really interesting things up around strategic collaborations, which I think this first webinar has started to do. I think these are genuine strategic collaborations with so many people. So I would really just like to thank all the speakers and all the participants. This has been a really powerful first Oceanic webinar, and I think we have an opportunity to really bring some work together. We will continue to do a work value study across the region, looking at some of the health workforce issues. We know many of these things have been on the table for many years, but I think this is a really lovely way to go forward. Julie, would you like to say a thank you right at the end?
Yes, hi. I'd like to thank all the presenters today. It's been fantastic. There's been so much information, but also really highlighting the innovation and the determination for all of us to make the world a better place and to support people in their mental health and well-being. I particularly like to thank Michelle for moderating the webinar. It's not an easy task with a 2-hour webinar, so thank you, Michelle, and to thank all the members of the webinar working group and the Oceania Mental Health Advisory Committee. But most importantly, to all the speakers who spoke here today and to all the attendees to the webinar, and thank you for your fabulous questions and comments. And I wish everyone safe travels wherever you are. Thank you.
Thank you all, and goodbye. Have a good day. Bye.